clinic. We stopped the clinic in 2014. We closed down everything in China and we moved it to North Carolina in the United States. And there we have quite a large clinic. We have the largest herbal pharmacy in the southeast of the United States. It's a very active clinic. We have 3 practitioners, 3 massage therapists doing Chinese body work, 300-400 herbs, constant teaching, people flying from all over to train with us. And we're able to give them very in-depth training because they're with us with the patients, and we do not leave our patients. When I treat a patient, I'm there with the patient for 40 minutes the entire time, working on them, making sure everything is done correctly, continues done correctly. So the people who are training with us can really see, here's the medicine in action. This is what it takes to make this patient better. This is what a day is like. And it's important to have that because I think one of the reasons that I have the skill I have is nothing special about me. But of course, number one, I was training with those old doctors who were practicing clinically focused medicine who were born and educated prior to 1949. Okay. But 2, they were seeing patients that were quite sick and quite variedied and everything from broken bones to everything, you name it. And I was seeing a lot with them, next to them, and they were talking about it. And I was copying down every single herbal formula written. And that went on for years and years. And that internship, that idea of seeing it and being exposed to these very sick people, but not me making a decision. Someone else makes the decision. And then I can see what they did, and then I can see the results. And today, in the United States at least, a student goes to school, and then they are in a student clinic. And so they follow another student in the beginning. I mean, how scary is that if your exposure to Chinese medicine is a 3rd-year student of acupuncture? That's where is marking your initial imprint. Oh, this is what I do. That's very scary, right? And then they're overseen by faculty members, and I have no idea here, but in the United States, the usual faculty member in a college of Chinese medicine is a person whose practice is not busy enough to pay their rent. Because you're not paid a lot to teach in the United States. It's very, very poor pay. So why would a person do that unless they couldn't make any money or they are truly altruistic? So we have low-skilled teachers of clinical. They may know their knowledge very well, but clinically they have very little experience teaching students who are following students, and then they're put out in the world. They're supposed to know what to do. They didn't see medicine ever done well. They didn't see medicine done well for years. And that missing link is huge. I would never let a Western medicine practitioner do surgery on me if they graduated from medical school and never spent a day in a hospital doing surgery and watching surgeries and assisting. And if I wouldn't do that there, why would I do that with Chinese medicine with anything serious? Very scary, that lack of internship and training and mentorship. And it's going to take a while to change because even if we said we need mentorship now, how many people really have clinical skill to mentor? And that's a big question now. There are lots of people who've been in practice for a very long time and they're very good at the way they do it. But if we change their patient base, if we make them uncomfortable by giving them this patient and then that patient, do they still have a skill set? And that is an issue we face. People often ask me, should I study in Taiwan or China? And I can't say now because my exposure was 30 years ago, right, the 80s. But I started off with Chinese medicine in Taiwan, I moved to China, and I would always say that if you want to find a clinically skilled practitioner, you'll find good ones in Taiwan and poor ones in China. And so if you're looking for clinical breadth, the average Taiwanese practitioner has much more skill than the average mainland practitioner. And that's because the Taiwanese has an open practice. It's a private practice in a neighborhood. So everything walks in the door. The grandmother who's upset with their daughter-in-law and is having almost a heart attack, but it's anxiety driven. The person who got hit on their motorcycle, the dog bite, this variety, road rash, I mean, you name it, food poisoning. And so they're exposed to so many things, and if they don't have some tricks, some formulas they've memorized, some things passed on by their teacher, they go out of business. So their daily exposure is enough to give them a level of skill that allows them to be functional. And in the mainland, they're in hospitals, they're in specialized clinics, they're in the heart department or the kidney department or the acupuncture something department. And there's no variation. There's so many patients coming in that if they do well or not well, they're still there. But if you want to find the very best, you have to go to the mainland. And that's nothing to do with Taiwan, it's just a question of numbers. The mainland population is so large, and the tradition of medicine is in the mainland. It went to Taiwan, of course. But if we're really going to dig under the hood and find people who really know the classics, who can really open the classics for you in a clinical way, not in a scholarly way, then the mainland is where you find the best. And so what I tell people is, if you're able to find a neighborhood practitioner in Taiwan, the exposure you'll get is fantastic. But if you're willing to stick it out in the mainland and really, really hunt for years trying to find the right person, then you can find great training. But it's a risk, because what happens if 7 years go by, 10 years go by, and you didn't find anyone? And those are the differences over there that I see in terms of skill and what's needed and what's missing. Because the truth is, in the mainland, there's also a very big lack of mentorship. It's the way it's practiced is there's very little worry that a student is going to carry on for you. Where I am in my clinic, I'm desperate for people to achieve a level of skill that I can rely on them. My wife and I have too many patients. We need help. We need people we can trust. I need to train them in everything I have as fast as possible so that when they're working on someone, I can trust the right thing is done, that if they do the wrong thing, it won't be too wrong, and they know to look up and say, okay, this I don't know the answer, I know what to ask. But what makes me nervous is I'm often asked to guest treat. So a person will say, oh, I have this patient, can you see this patient? Or I have this patient, let me ask you. And that happens to me all the time. And I'm very polite about it, but I always find it funny because I'll have these people say, and their pulse was a little slippery, wiry something, and their tongue was something, and I don't trust them. Why would I believe that they took that pulse correctly? Maybe they did, maybe they didn't. But there's so much argument about all this that they didn't train with me and we don't have a common language. If they said they moved the chia, well, did they imagine it? Did it really happen? Did the patient experience it? Was the needle even in the right place? Who knows? And by training people the way we do in our clinic, we're creating this common language of foundational skill. And the foundational skill is good, strong, deep chi in the hands, the ability to tangibly make the chi move up and down the body, where I can feel it moving and the patient says, what is that moving up my arm? And then draining down the arm. And it's not magic, it's hard work. But by creating this solid language, this foundation, then the language works, internship moves forward. To get around to what I was just talking about, there's so much, they say, secrecy in the mainland, or the idea that they are baoshou. They are very conservative in their teaching. And the expression is to teach the student is to starve the teacher. I will honestly tell you that in all of my years meeting that old generation, the moment they looked at you and realized you were serious, they couldn't do anything but teach you. I've never met a conservative teacher who really had skill. I've met a lot of them who would be quiet or insult the students and not teach them anything because those students weren't worth teaching, 100%. But the moment they saw someone who was worth teaching, they couldn't help it. It itches. You see them trying to do something, or they got it wrong but from the right direction, and you can't help but correct it. And I think that that's what's missing. I don't see that in the mainland anymore with these teachers, that there's no... I don't believe a lineage is anything more important than anything else. And most lineages, I think, are full of that. And all a lineage means, in my opinion, because a lineage going down, what if someone in the middle was lazy? What if someone wasn't smart? Then that kind of destroys your lineage, right? I mean, so it doesn't matter 88th generation. The more numbers in your lineage, the more chances are it's left from what it should have been. But the importance of a lineage is that anything that occurs to me, I'm very excited, and suddenly I go, oh my goodness, if I just do this, this happens, and now I'm going to use this herb and this treatment, and that's going to make such a difference. And then the teacher says, no. I can tell you, I was excited about that, and I did that, and I realized after several years, it doesn't work. And a lineage is all of the things that I'm going to become excited about, I can pretty much trust my teacher did too, and his or her teacher did too, and they go, no, that one didn't work. This one works. That was a shortcut that was a dead end. This is something to pay attention to. And so by the time it gets to me, I'm saved. All of these mistakenly direction things, I'm saved time, but I still have to work. The analogy I use when I teach is that if I head into the rainforest and it's really thick with the machete, how far am I going to get on day one? 10 feet? 20 feet? Hacking away at the vines and everything? But I go to bed, next day I wake up, I can walk 10 feet into the jungle in 10 seconds. And then I hack another 10, 20, 30 feet. All right? Day after day, I've made quite a path. Now imagine 20 people, each generation, going into that forest. By the 20th person, how far they can walk before they hit jungle, before they hit things they don't understand. And that's the point of a lineage. Nothing else is that people have helped you get somewhere clinically focused. And it's worth it if the lineage has that clinical, classical mix of focus.